congratulations for receiving the NPWH Inspiration Awards in the education category. It was my pleasure to support you in your nomination. What I've always found is that she gets more than 100% in using the eyes of an educator to get to the final product. She is truly inspirational and supportive of students and new and continuing women's health nurse practitioners.
She is so willing to uplift people where they're at, kind of really get to know people, know what their aspirations are, especially for those who want to pursue women's health, and be a mentor for them. And so because I've seen her as a mentee, as a student, and now as a colleague even, I really wanted to recognize some of the accomplishments that have brought her to this point, not even just academically, but in her clinical practice, in her writing, in the books she's published to impact a ton of students around the world and country. That is why I nominated her for this award.
This award means so much to me in the sense that it's a culmination of all the people that have allowed me and helped me and supported me to be here. I feel very grateful for having amazing mentors along the way who really believed in me when I doubted myself. I was born and raised in the Philippines, and when I moved here in high school, I did not see myself reflected in the teachers that I had, the leaders of the school, and that carried through in undergraduate studies. It carried through graduate studies in my master's program and my doctoral program, except for when I was an undergrad, I had a professor who looked like me. Her name is Dr. Ayers. And I was sitting, I still remember as a junior nursing student, looking up and going, that's what I can do. I can do that. I also was asked to start teaching, and I started with teaching clinical and really loving teaching undergraduate clinical, taking students into the hospital. And then it just blossomed from there. My goal is to make sure that I'm leaving behind a pipeline, and that I'm able to support that pipeline of women's health nurse practitioners who will take this profession through, and even be a better generation of nurse practitioners who are more equipped with being able to help our patients to have better outcomes.
Really does always have that lens on of how can we improve, or what can we do next. So Tammy and a team that she was working with saw a need in distance education even prior to COVID on ways that we could improve skills for patients and some of the hands-on and learning experiences for them. And so it's exciting now looking back from a post-COVID lens to see their foresight in that. And that research has really been able to propel growing our program, improving our program. Congratulations, Tammy. This is a well-deserved honor, and it's an honor to work with you.
I feel like it's a real honor for my peers and colleagues to have nominated me for this award, and just the recognition from them on all of the energy and all of the effort that it took to go from data from a student survey to a prototype of a pelvic model, all of it in between. Just the recognition of all that energy and effort is just such an honor, and it's humbling. I think we always go in and are trying to help a patient problem solve, meet their goals in healthcare and wellness. So there's a natural transition or progression to it in research and quality improvement. The foundation of it is patient care. And there's just nothing better, nothing more satisfying than going in with a patient and being able to help them on their health and wellness journey. I love being a nurse practitioner. I love being a women's health nurse practitioner.
Dr. Borella's nominators say she exemplifies integrity in her work, and she is committed to maintaining the highest standards of ethical behavior, professional conduct, and safe, effective, evidence-based practice. Dr. Borella recognizes that every woman is unique and deserves care that is tailored to meet their needs. Congratulations, Dr. Borella.
It's awesome to be able to be recognized for something that I love to do that I really don't feel like is work at all. I enjoy my job so much. And it also inspires me to continue to be an advocate for these patients. I kind of got a late start in nursing school. I had a career before this one, and then came back for a second career. And when I was in the undergraduate program, just fell in love with women's health. I have been practicing at a clinic here in Birmingham that serves the underserved population, to see the patient as a whole, and that all patients are the same, should be treated the same, should be able to get the same type of health care, regardless of where they are, regardless of their race or their income, their education. They needed women's health care. They needed more care, in that area. And then I realized just how many women here had a hard time even just getting screening, either being able to afford to get somewhere, to have somewhere to go, having the transportation to go. It wasn't what I learned about in school, because in school, everything was just kind of black and white, really easy. All your patients, had insurance, and that was how it was. I learned that I needed to take care of the whole patient. I was there to look at their entire situation. Sometimes they just want somebody to talk to or to talk to them, so that they could understand exactly, what was going on, why they were taking certain medications, why they were having to do certain, diagnostic procedures or what have you. So, we're trained as nurses to listen. I think that's what's so great about being a nurse practitioner. We are not just in and out, but we're really there for the whole patient, to educate and to be there for them.